Uh, now we can go. Alright, so this is going to be the last part of the recordings, and this is going to be on bipolar disorder. So we have here anticonvulsants. So we're going to go into anticonvulsants in a little bit when we talk about medication for bipolar disorder, because anticonvulsants are actually a common therapy used with bipolar patients. But however, first we have to define the disorder and see the characteristics behind it. So, a bipolar disorder is characterized by mood swings from severe depression to extreme euphoria or mania. How I think about bipolar disorder is kind of like a wave, like a little wave. And how I think about with mania is going to be like the top of that wave, while depression's like the low of the low. Mania, depression. However, with our bipolar 2 patients, maybe like your mania starts like kind of like a hump. Like a little hump. It's like a big hump. Little hump. Big hump. Like a big hill. Maybe I should have said humps. But it's going to be to a lesser degree of mania. So a manic episodes. So basically like in the middle of the wave is when you have that like normal mood. But during a manic episode, so the mood's going to be elevated, expansive or irritable. There's going to be noticeable changes in behavior. You're going to have that high self-esteem or grandiosity. They're going to be insomniacs. They're not going to want to sleep. They're going to be awake for days and days. They're going to be full of energy. They're going to be talkative. They're going to have that flight of ideas and circumstantiality. They're going to have racing thoughts. They're going to be very distracted. They cannot focus. They're going to have increased activity. They're not going to be able to follow goals. They're not going to be able to follow teaching. They're going to be very labile. They might be aggressive. They're going to be demanding and attention-seeking. So excessive involvement, they're going to have high potential for painful consequences. They're not going to be able to take care of themselves during this time. And they're not going to know that they have an illness or anything. So during your manic episode, one thing we need to do with our client is give them structure and give them high intensity kind of workout things and more of those like energy focused activities, because these patients, they're going to have a lot of energies. They're going to need high calorie finger foods for their food or to get energy. They're going to be constantly on the run. So, but we need to make sure that we have structure with them. And we need to set limits as well. So your depression episodes, they're going to have lack of energy. They're going to be crying. Basically, the same thing that you would have with normal depression, actually. Those are nursing interventions, so I don't want to go to that yet. You don't want to go to that. I want to talk about a few things for our bipolar patients. So, bipolar 1 disorder. We need to make sure that we define this. So, bipolar 1 disorder is where the client has at least one episode of mania alternating with major depression. So they're going to be on a full manic episode. They may have normal behavior, and then they're going to go straight into depression. So bipolar 2, which is different than bipolar 1, they're going to have one or more hypomanic episodes alternating with major depression. To define hypomania, it's going to be a less severe episode of mania that lasts at least 4 days with 3 or more manifestations of mania. So the person who has hypomania, they're going to be less impaired, but it can progress if need be. Lastly, cyclothymic disorder. So the client's going to have at least 2 years of repeated hypomania that do not meet the criteria for hypomania episodes alternating with minor depression. So it's going to kind of be like maybe like a mood fluctuation, but it's going to be more than just like a simple like moody with them. They're going to have those hypomanic episodes that don't meet the criteria, but they're also going to have minor depression. So, one thing we need to emphasize with our patients with bipolar is to have structure. We need to make sure that they are limiting their substances. We need to make sure that they have a stimulating environment and a safe environment. We need to make sure that we monitor their self-care needs. We need to make sure that we decrease stimulation if needed. We need to give them rest periods and give them physical activity opportunities. We need to also assess for suicidal behavior, of course. Safety is number one with these clients. Let me tell you something. If there's an answer that involves safety on the exam tomorrow, it's probably the correct answer. Make sure with your therapeutic communication, you stay very focused. You use short and simple sentences. You give concise explanations. You make sure you set limits with these clients. You absolutely have to set limits. Do not argue with the client. You need to reinforce the good. And you don't want to let them manipulate you. So, some nursing interventions we can do. We can be firm and calm, be short and concise, hear and act on legitimate complaints, and redirect the energy into more appropriate behaviors and actions. So maybe the client is beating up another client. That's manic. What we could do is we could bring the client outside and let them maybe play basketball or something. Maybe if they're running around the unit, maybe let them go outside and run around the field. That might be a good thing for them. Remember, we want to always redirect. We need to set limits with the patient, and we need to give them finger foods because they're not going to want to sit down with us. They're not going to want to. They're going to want to go run around. They're going to be high energy. And then with our depression, we're going to use similar depression tactics that we used in the other, when we talked about depression. Now we're going to talk about pharmacology. So, our mood stabilizer that we use for bipolar disorder is lithium carbonate, or lithium. So, it's not understood, but modulates transmitters. One thing we need to know is the range of therapeutic serum concentrations. So, remember, we want it to be between 0.8 to 1.4 or 0.6 to 1.2. One thing is, with patients that have lithium, we need to make sure they get their blood levels drawn. And we need to also educate them that it may not start working immediately. It's going to take at least 2 to 4 weeks to show at least little effects. We need to know the difference between what's toxic and what's not toxic. So they're going to have, for low toxicity, it's going to be barrel vision, ataxia, ringing of the ears, nausea, vomiting, diarrhea. As you get a higher concentration, you're going to have polyuria, tremors, irritability, motor retardation, and confusion. And then above this, you can have impaired consciousness, nystagmus, which is like the eye jerking. We talked about this in our substance abuse, where we do like the field sobriety test, and you have to follow the finger, and you have to watch and see if their eyes can smooth pursuit or not. Seizures, coma, oliguria, arrhythmias, MI. So these are going to be very serious, and this is why we need to draw blood, because we need to make sure those levels are here. Above 1.5 is toxic. So they should be taken once or twice a week until doses are stable. and we need to make sure that we draw the blood. We need to realize with our patients that are taking sodium, we need to make sure that we increase our sodium levels. So if sodium is decreased in the body, lithium is reabsorbed and will increase level. So if sodium is down, somebody who's taking lithium is going to have higher chance of toxicity. So with our clients who are sweating, we need to make sure we give them sodium and fluid. And a lot of these clients that take lithium may be in a manic episode. So we're going to want to encourage them to drink something, especially if they're running around and they're active. So antidepressants can be used to, like SSRIs, used for depression, of course, and usually they're going to be combined with mood stabilizers like lithium to prevent rebound mania. So, and antipsychotics, such as second generation or first generation, may be used to help with sleep and lowering anxiety and agitation. The antipsychotic that's going to be the most effective first is going to be your second generation. We talked about this earlier with schizophrenia, but second generation antipsychotics are actually going to be better than the first generation because they treat both positive and negative symptoms. While first generation antipsychotics, yeah, they treat things quicker, but they're only treating the positive symptoms. So I meant to mention that earlier. But here, antipsychotics are going to be used to promote sleep and decrease anxiety. Now we're going to get back to our anticonvulsants. So anticonvulsants such as carbamazepine, valproic acid, and lamotrigine. These medications can be used for epilepsy. However, with bipolar disorder, they can provide symptomatic control with patients who have it. So we may want to use an anticonvulsant with somebody who has bipolar disorder. So it may suppress high-frequency neuronal discharge. Similar to our phenytoin might be there too. Yes, it does prevent seizures, but it also works with bipolar disorder. So adverse effects, they're going to have visual disturbances, ataxia, vertigo, headache, bone marrow suppression, leukopenia, teratogenic. Remember, no grapefruit juice with this medication. So, but the one thing is we want to make sure that they're safe. They use good communication, and that they are structured and that limits are set. So yeah. Something I meant to mention earlier. I just forgot it. Just forgot it. Never mind. Let me make sure I got everything that I wanted to talk about. I think that's everything I wanted to talk about for bipolar. Does anybody else have any questions regarding bipolar disease? I feel like I went through that really quick. No. I feel like I went through that really quick. Okay. So with that, I'm going to stop the recording.